Hi, my name is Marianne Oakes. I'm a complex abdomen specialist at Regents Hospital, a level 1 trauma center in St. Paul, Minnesota. And I love complicated wounds and fistulas, necrotizing soft tissue injury. So I started this YouTube channel with, if you want to subscribe, you can get updates from us, all about the how-tos of what I do at work. Looking to just have a discussion with you guys out there. You can email me or text me if you have any fun patients that you want to talk about or anything like that. So we're going to talk today about negative pressure wound therapy with Instillation on sacral wounds. It's the same decision-making as that you've seen probably before. I look at the wound, but I like to take a step back and look at the peri-wound skin, because we know that these negative pressure systems, they don't work well if you don't have a good landing zone around the wound itself to make your sticky stuff hook to. So look at the peri-wound skin. Is it super healthy? Then I'll just use standard acrylic drape. And if it's not, then I'll go with that new silicone hybrid drape. Then I look at the wound itself. Does it need to be debrided? If yes, I call the surgery team for evaluation, take my pictures, and put them in the negative pressure Instillation with the waffle foam, because that's the one that does the debriding. And then if they don't necessarily need to be debrided, I can do negative pressure with or without Instillation. And then I'm always thinking about discharge. I try to never send anyone home with negative pressure wound therapy if they are using a cane or a walker or just kind of are unstable, or if they don't have a home, like they don't have anywhere to plug it in, that kind of thing. But if I do send them home, there is a new option to do Instillation in the home theater, which is amazing. And so a lot of times I'll do that, even if it's just twice a day, it's hand instilled. It's just nice to get that washing machine kind of effect at home. And then there's always the option of advanced wound dressings, which I also love, like the Aquacel AG and Hydropheric Blue. I always try and get Meplex border dressings over the top, just to keep everything together. Sometimes it's hard to get covered, but I do the best I can. So the two technique tips that we're going to talk about today: using the Instillation port inside of the foam and using the Instillation port outside of the foam, and how we do bridging. This is a couple layers of the waffle foam because we really want that waffle foam touching absolutely all of the wound. You can see we've done our barrier ring around the edges, set it back 1/2 centimeter, and then we're clear draping over the top. And then the Instillation port, we really want to get the fluid to the problem, right? So we put the Instillation port right inside of the foam. And this particular gal would not get off her backside. So we knew even if we put it on top of the foam, she's never going to be sidelined. So we tried to get the instill where we need it to be. So the instill goes into the foam, and then we put the cover layer on. So you can see that the little instill port is coming out of the foam itself. And this is where we put the negative pressure port. So instill ports here, cover dressing over the top, clear drape the whole thing. And then the instill tubing runs up the bridging, which we use the thinner foam as the bridging, and then a thick foam to land our track bed. And then I like to offset all of the pressure with Meplex board dressing. So we actually put a big Meplex board dressing over this too. I just didn't have a picture of it. So here's another patient. He had some skin issues, and so we used the Dermatac Drape. This is the drape with all these little holes, and so it's silicone and acrylic together. He was wonderful, and so he would sideline as much as we would ask him to. So we put the Instillation port on the foam. This little piece of foam is just on top of everything, holding the Instillation port tubing from getting kinked, because you can see he's kind of got a dip here. So we just put that on and just used some drape just to hold it in place, but the drape wasn't touching his skin. The Dermatac is the only thing touching his skin. Then we ran it up past the negative pressure port, which you can see we use thin foam here and then a thick foam top. Huge Meplex border dressing on the backside just to offload pressure, and also it just keeps the back intact. These little negative pressure ports, remember that you have your standard negative pressure. In the large kits, you have them separate, which is what we do for all of our sacral injuries or backside wounds, whatever you want to call them. The medium dressings have them together. And so whether you put that on the wound itself or up on the top of your bridge, it just doesn't work. If you put it on the wound, it's very bulky, and I would be worried that it would cause more pressure. And if you put it way up on the top of the bridge, then the fluid's got to go all the way down that bridge and then somehow go into that wound bed. And we just had problems with leakage because you'd have to use so much volume to get all the way down the bridge and into the wound. When we put the installation right on the wound foam itself, you can use a very small amount of volume. That way you don't really have any leaks. I think they probably figured this out because they sell these separately without foam. So even if I'm using a smaller dressing, I can just grab these and add my installation and negative pressure where I want them. So that's kind of nice. So here's one more example of a backside bridge. We also bridged, instead of using clear drape on the skin, we'll use a Meplex border as the skin protectant. And so here's the installation port, a Meplex dressing, and then we just clear drape over the top of the entire thing and use the Meplex as the skin protectant, if that makes sense. And then here's another one without the Meplex dressing. We put down the clear drape first and put our port down here, and then clear drape over the top of the whole thing and a nice big Meplex dressing just to protect and offload. In this case, here's the wound here. We have our installation port. You can see we have a little bit of a step down here. I would be worried that we might have some blockage to our instill if we left it just as is. So we put two big Meplex sacral dressings over the top, and that just really helps to just keep your VAC in place, especially folks that like to slide around. This is the last case. This is a gentleman, we did the same thing. He had a lot of necrotic tissue, and so we put him in installation. He was definitely a slider, like one of those guys that you're like, oh my gosh, you just would slide back and forth. We put a bunch of big Meplex border dressings on, and look at how great he looked. The PA came in and she just literally clipped this all away, and he went in for skin grafting, which, just really does your heart good when you can get people in 1 week to come that far. So learning points before our demonstration is use separate trackpad and installation port. Seems to work better for these types of wounds. Put your installation directly over the wound. You can use silicone border dressing under the bridge and also over the top of the foam, as you saw. And then bridge with installation thin foam, and make sure you put that big fat circle of foam at the end of the bridge to land your negative pressure system. And sometimes, I didn't have any examples of this, but we'll do a floating bridge. So we just sandwich the bridge between two pieces of drape, and then that bridge can move around. If people are so tender, you may have to do that. Thank you to Mr. Butts for coming today and helping us demonstrate how to do this. It's very exciting. Poor fella, he does have a lot of wounds. Okay, so the first thing we talked about is looking at the peri-wound skin. I mean, Mr. Butts looks pretty good. He does have a little bit of schmooze there, but I would take my handy dandy wash, which I love, especially this cute little bottle, and I would wash in the wound, I'd wash all around the wound and dry it off good, right? Okay, thanks, Wash. The next thing I like to do once I have it nice and dry is Cavilon Advanced. Now, this is different than the Cavilon that you see in the little wipies. And so Cavilon Advanced is more like a Dermabond, and it will seal the skin all around it. So his skin looks pretty good. And so our decisions are, do I want to use Cavilon Advanced and your standard Veraflo drape, because these guys go together, or do I want to skip the Cavilon and use the new Dermatac drape that has the silicone in it? So this silicone drape has silicone and acrylic, and so if you're going to use this, you don't use the Cavilon Advanced. I'll leave that up to you guys as your choice if you want to do one or the other. So then I use the Hollister 7806 barrier ring. Comes in this cute little disc, and I just take it out and then I trim it so it looks like a ring, kind of like this, like a circle. Okay. So I'm going to take my barrier ring and I'm going to put it all the way around the edges, 1/2 centimeter setback, so I can really see the junction of that skin and the wound itself. So once I have the barrier ring all set up, then I cut strips of my drape and I put them around the edges. I know this takes a little bit extra time, but you really don't want any leaking with these posterior wounds. And I'm using the drape with the silicone on it today. And then you can see I'm smoothing it in right to the edges. So look how nice that looks. You can see, oh, the camera has a great view of this undermining that we have right here, which is just so common in these types of wounds. I think this is supposed to simulate bone. We don't have to cover the bone with any kind of contact layer if you're using this type of dressing. And so I like to use the dressing as my pattern maker. I know this undermines over here quite a bit. So I'm going to actually lay the dressing as I would if it was undermining. And then I just make clips in my dressing just to guide me to where I need to go. So I use this kind of as the pattern maker. Sometimes I like this dressing to be a little bit bigger because it's going to go into the wound bed. Finished the guide, oversized, and you can always add little pieces, obviously, because this kind of foam you can layer. So this is going to go underneath here in the undermining, and this is going to come up here. And so this side, it wants to kind of hammock a little bit. So I'm just going to trim it so that it lays nice and flat in the wound. And you really want to have it touching all sides of your wound. So we have this little piece peeking out here. You should always number how many pieces of foam you put in your wound when you're doing your documentation. But if I had a little extra like that, I could put that in there. And I want to make sure I get it over that necrotic tissue as well. Then we just need to do a cover layer. And so a lot of times I use my pattern, but I pre-made it for this. And then we're just going to put it over the top. So this is the thicker, not the thinner cover layer that it comes with, right? And so this will go here and we'll close it up. But first, when I get to this point, I kind of have all my pieces. Then I will put my bridge together. So we can bridge with Dermatac Drape. It's nice on the skin. And then we can add the acrylic over the top, which is something that we do a lot of because we don't have Dermatac in our foam kits. And so we have to grab it extra. So I'm going to put my bridge lateral for him. And you can see my Dermatac has become a ball, but just unpeel it, which is super sweet. And then just remember to lay it down, don't stretch it. This is kind of the setup I have for bridging. I use the thin foam for the bridge itself, and I always put a thick piece at the very end so that I can land my negative pressure track pad on top of this. This is really where another person is so very helpful because I'm going to want to lay my bridge in and kind of put it all together. So if you have somebody to finger hold, it works great. If, you know, like I usually work in the abdomen, so I usually have the patient hold, but the other thing you can do is just take a piece of drape, a spare piece, and put it where you want it, and then just kind of lay it over the top. And so I have the Dermatac drape on the skin, but I'm going to put the standard acrylic drape on my bridge. Remember, we don't want to pull the drape, we just want to lay it. Because installation is so difficult because if you have any of these little crinkles and wrinkles, you can have a leak potential, right? And so I'm always trying to be wrinkle free. So now I have the tongue of the bridge into the wound bed itself. And I want that because I'm going to put this, remember I got this little extra piece. I'm going to put this foam over the top, but I want this to touch one another. If they touch each other, that's how you get the negative pressure to go up to the top, right? Now I can put a big piece of drape over the top of this wound. So my goal here is to touch the brown edging. So I want to make sure that my foam that I'm placing is smaller than my brown edging. And then I try and touch the edges because that's where we're going to get our super seal. At this point, we're ready to put our track pads on. And so I'm going to trim my installation port right here directly over the wound. I'm going to put this on top of the foam. Remember, we had an option to go under the foam, but today we're going on top of the foam. And really, we just need this little circle cut out. So you don't need a huge hole for this. And so we're going to put that right here. And we're going to run the tail up the bridge. So we're going to put this on here. And then we're going to run this right up the bridge. I usually take a skinny piece of this, try and make sure this is nice and flat. And then I just tape over it just so it doesn't move around. Then we're going to put the negative pressure track pad over here. So when I put this on, I also have the tail going the same direction. So everything comes off the side of the patient. Then remember, orange to orange, right? That's these two hooked together. And then the negative pressure. So now we have our seal and we're all happy. But I wouldn't be done now. I put a huge sacral Mepilex dressing over the top of the installation port for two reasons. We're going to do that to offload pressure of the thickness of the foam so we don't extend the wound. And also it really helps just to keep all this in place in case like PT comes and puts on a slide board and they slide across to go to a chair or whatever. It'll just help keep it in place. So they have the big ones, I'll do the whole thing. And then if I don't, sometimes I'll add another Meplex over here, just kind of doing the same thing, offloading the whole thing. Okay, so now you can see that during this instill, the fluid is going directly on the wound, which is what I really want. That way I know that I'm getting good coverage of the VAC into the wound bed itself before the negative pressure comes off. And again, that's another just great reason to have that big Meplex border dressing over the top of this, because during the instill phase, you don't have negative pressure, right? And so I think that that is super important to do. So you can see the VAC now is taking the fluid back out of it and out through the negative pressure port. And there you have your negative pressure dressing for your sacral wound. So that's the end of our sacral dressing change. I hope you guys can use some of the tips and tricks in your practice. And don't forget, you can always email me on the complexwounds.com website if you have any better ideas. I would love to hear them, because I think these wounds are always challenging, and we'll see you next time.